Acute Care Nurse Assistant. Module 9. Endocrine Care. Statement of Purpose. The purpose of this module is to provide learning experiences that will prepare the nurse assistant to safely carry out procedures which support the patient in meeting the endocrine care needs that the patient cannot perform independently. Terminology: acetone breath, adrenal glands, anti-diuretic hormone, blood glucose monitoring, diabetes insipidus, diabetes mellitus, diabetic coma, diabetic ketoacidosis, endocrine, gestational diabetes, glucose blood sugar, gonads, hormones, hyperglycemia, hypoglycemia, insulin. Insulin-dependent diabetes mellitus, insulin shock, ketosis, small respirations, neuropathy, non-insulin-dependent diabetes mellitus, pancreas, parathyroid glands, pituitary, polydipsia, polyphasia, polyuria, syndrome of inappropriate ADH, thyroid. Performance standards, objectives. Upon completion of 3 hours of class plus assignments and 3 hours of clinical experience, the learner will be able to define basic terminology, describe the basic structure, function, and common disorders of the endocrine system, recognize abnormal signs and symptoms seen in diabetic patients, describe the role of the nurse assistant in caring for the diabetic patient, discuss effect of diabetes on the other body systems. Section 1. Basic terminology. Terminology and clinical application. Section 2. The basic structure, function, and common disorders of the endocrine system. A. Major hormones. Pituitary gland, thyroid gland, parathyroid glands, adrenal glands, pancreas, and gonads. B. Common disorders: hypothyroid, hyperthyroid, diabetes mellitus. Section 3. Abnormal signs and symptoms seen in diabetic patients. A. Polydipsia. Thirst is very common in elevated blood sugar. Kidneys are washing out high blood sugar, pulling fluids from the body, leaving the patient dehydrated. Do not restrict fluids unless ordered. Keep patient hydrated even if water carafe frequently needs to be refilled. Unlimited water, black tea or coffee. May use non-sugar sweetener, but creamer and milk may be restricted. Diet soft drinks or broth unless sodium restriction. B. Polyphasia. Hunger occurs with high blood sugar as well as low blood sugar. With high blood sugar, glucose is trapped in the bloodstream and does not get to the cells, so they send hunger message to the brain, not knowing there is plenty of sugar in the blood. Patients are not necessarily non-compliant if they crave foods. Ensure a proper balanced diet. If the patient seems to be eating only carbohydrates or only protein on their tray, have the nurse explain the importance of eating balanced meals. Do not supplement the tray with other foods unless approved by the licensed nurse. In diabetes, we must think of food as medicine. Polyuria. When blood sugar reaches a certain level, renal threshold, the kidneys start letting the glucose out into the urine, and the patient starts urinating in large volumes and frequently. The symptoms recede when the blood sugar drops below the patient's renal threshold. Report frequency and output volume. Hypoglycemia. Low blood sugar below 60 milligrams per deciliter. Report immediately to licensed nurse even if the patient is not symptomatic, since this may lead to coma and death. Patient will require immediate treatment. Symptoms include restlessness, apprehension, irritability, trembling, weakness, sweating, headache, hunger, difficult thinking, blurred or double vision, difficulty walking, tachycardia, and changes in level of consciousness. Hyperglycemia. High blood sugar over 125 milligrams per deciliter. Report all blood sugar levels to licensed nurse since patient may require treatment. Very high blood sugar may lead to diabetic ketoacidosis or hyperosmolar syndrome, which may lead to a coma or death. Symptoms include excessive thirst, excessive urination, hunger, weakness, flushed and dry skin, headache, nausea, vomiting, abdominal cramps, weak and rapid pulse, low blood pressure, acetone or sweet breath, rapid breathing, Kussmaul respirations, and change in level of consciousness. Section 4. The role of the nurse assistant in caring for the diabetic patient. A. Dietary issues. Restrictions, accurate measurement of intake, and reporting lack of food intake. B. Skin care or foot care. C. Reinforcing patient teaching as directed by licensed personnel. D. Reportable signs and symptoms for hypoglycemia. Irritability, anxiety, shakiness, sweaty, slurred speech, dizziness, hunger, impaired vision, headache, weakness and fatigue. E. Reportable signs and symptoms for hyperglycemia. Extreme thirst, frequent urination, dry skin, hunger, blurred vision, drowsiness, nausea and vomiting, deep breathing pattern, sweet or fruity odor breath. Section 5. Effect of diabetes on the other body systems. A. Kidneys. Watch patient's urine output, volume, frequency, odor, and casts, which are particles which can indicate infection, or foamy, which indicates excess protein or a vegetarian diet. Polyuria, higher blood sugar. Often urinary tract infections in diabetics do not have typical symptoms. B. Eyes. Increased risk of intraocular bleed, especially type 1. No heavy lifting or straining with bowel movements. Report immediately any complaints of double vision or curtain dropping. Complaints of blurred vision with rapid onset could mean low blood sugar, or more likely high blood sugar. Often takes 6 weeks to improve. Cataracts are more common in diabetics due to the years of glucose and sorbitol seeping back and forth and in and out of the lens. C. Heart. Hypertension often occurs before diagnosis of diabetes mellitus. Increased blood pressure correlates often with increased blood sugar. Heart attack in diabetics may not have the usual symptoms. Important to report vague chest discomfort, subscapular pain, diaphoresis, etc. D. Integumentary. Impaired wound healing with increased blood sugar and impaired immune system equals greater risk of infection than general population. Imperative to have good hand washing. Skin care is the nursing assistant's most important contribution to patients with diabetes. Report increased wound drainage or change in color or odor. Minimize number of skin breaks. Ensure only poking once for blood sugar testing and hold pressure on injection site to clot off. Essential Q2 hour position changes. Exemplary skin and perineal care. Do not soak feet for more than 5 minutes. Report any reddened areas or wounds, even if the patient states it doesn't hurt. Always have patient wear shoes or slippers when out of bed. E. Nervous. Decreased sensation due to nerve damage over time with high blood sugar, usually in the feet first. Patient may not feel hot or cold, pain or pressure. Observe feet, Q-shift. Use lotion and any pressure-relieving devices even if patient does not complain. If feet in poor condition, report to nurse. Perhaps a podiatry consult is in order. Patients may have autonomic neuropathies as well, such as neurogenic bladder or bowel incontinence. Some patients may lose the ability to feel effects of low blood sugar, especially when taking certain heart medications. Check blood sugar if patient is not arousable. Also report a low blood sugar reading even if the patient feels fine. F. Circulatory. If blood sugar is elevated, the blood is literally thicker. It may be more difficult getting blood for a finger stick. Try warm compress before poking. Do not use alcohol on the finger. Use the earlobe if unable to use the finger. Do not use fingers if they are really swollen, as this would give a false low blood sugar reading. G. Fetus. High blood sugar is teratogenic, especially in very early pregnancy. If patient states she might be pregnant, report any blood sugar higher than 140 immediately. Later in pregnancy, a higher than 140 blood sugar will feed the baby too much, and the baby will grow too large, often 15 pounds or more. Normal blood sugar during pregnancy is 50 to 110 milligrams per deciliter.